IBS, or irritable bowel syndrome, symptoms primarily consist of abdominal pain and irregular bowel habits. And the bowel habits could be either diarrhea or constipation, or kind of swing between the two. Usually and frequently there are some other associated symptoms like bloating, belching, or gas. That's common. People that have irritable bowel syndrome, a lot of times anxiety can be a big producer, a big trigger to cause more symptoms to occur. What do you do about it if you do have these symptoms? There's a lot of things we try to do. First off, we try to make sure it's not something else, because there's a lot of things that kind of act like irritable bowel syndrome. Somebody could have Crohn's disease or ulcerative colitis, which are some inflammatory bowel diseases that can act a lot like irritable bowel syndrome and need to be excluded. But if you have irritable bowel syndrome, let's say we've done all the tests and it all checks out fine, because really these tests will be normal with somebody with irritable bowel syndrome, because their tests are all normal. Then what do you do? Well, first off, probably the most important thing is to be sure you have a doctor you can really talk to, because communication is key with treatment of irritable bowel syndrome. If you have a good doctor then that you feel comfortable with, the way we go about it is sometimes we'll look at the diet. You know, a lot of people ask about diet. It's different for everybody. But we'll look at maybe common things. And you have to try different kinds of things with the diet to find things that will help. Like common things are like milk, avoiding lactose, or avoiding gassy foods, or maybe even caffeine. But then looking at the other symptoms of stress. How do you manage the stress? Well, getting a good exercise program started. Or that's important, exercise. Or breathing exercise, just learning how to take slow, relaxing breaths, or maybe a little meditation. And then there's, what are the predominant symptoms? If somebody's having diarrhea, well, we can give things to control the diarrhea. Simple things like Imodium. And then there's a lot more complex things we can use.